Hello, and thanks for joining us for today's webinar on the unique contributions of fathers to their children's development. This webinar is co-sponsored by the Institute for Research on Poverty and the Wisconsin Child Abuse and Neglect Prevention Board. So IRP is based at the University of Wisconsin-Madison and is the sole National Poverty Research Center funded by ASPE at the Federal Department of Health and Human Services. And the Wisconsin Child Abuse and Neglect Prevention Board is a state agency that advances statewide policy, public awareness, and evidence-informed programming to strengthen families and reduce the likelihood of child abuse and neglect. The Prevention Board also seeks to address these goals through the mobilization of research and best practices. So I'm Dave Chancellor, and I'm on staff at IRP, and I'll be your host today. And I'm very happy to introduce our presenter, Dr. Tova Walsh, who is an assistant professor of the School of Social Work here at UW-Madison. She's also a research affiliate at IRP. So Tova, we're delighted to be hearing from you today. Thanks so much for being here.
Thank you so much for having me. I'm excited about this.
Okay. I also want to acknowledge the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their support of this webinar series from the IRP side. That said, any views expressed in today's webinar don't necessarily reflect any positions of ASPE, the Institute for Research on Poverty, or the Wisconsin Child Abuse and Neglect Prevention Board. So with that, Tova, thanks again for being here. I'm going to turn it over to you now, okay?
Great. So thank you, Dave, and thanks, everyone. I am happy to have so many of you joining us and really just very happy to have the chance to speak with you today about the unique contributions of fathers to their children's development. So, as Dave said, we have a large crowd with us, and I'm just really so pleased that so many of you have joined us because I think it reflects growing momentum toward understanding and recognizing the impact of fathers on their children's development. And in that next webinar that Dave mentioned, we'll be talking about how we can apply that understanding to think about efforts to support fathers' engagement with their children and to support fathers' engagement in child and family services. And, as Dave said, we'll have a couple of guests joining us, and so we'll also get to hear from people who are doing this work every day, some examples of the barriers and opportunities that they've encountered in working with fathers. So before I get started, I just want to tell you a little bit more about my background and how I came to focus on strengthening engagement of fathers with their children and on engagement of fathers within social services. So my background straight out of college was working as a home visitor. So I spent a period of time actually in Jamaica working with a program called the Roving Caregivers Program. And it was a program that had a model where they focused on early child development and parenting support and education in homes in rural parts of the country. So I had a role where I was supporting them with documentation. So I spent a year accompanying home visitors on their work going into homes and working with families with young children. And when I came back home to the United States after my year working with the Roving Caregivers Program in Jamaica, I worked as a home visitor in Massachusetts, the state that I grew up in. And so in both of those jobs, something was really striking to me. So both programs were using the language of family support and talking about parenting education, but in fact were really serving mothers primarily and almost exclusively. And, the training that people received, that I received, and that others received at those agencies really assumed that we would be working with a dyad because in most cases that was what was happening. And I really wondered over the course of my time in these roles, what more could we be doing to engage fathers? So when they were present, what could we be doing that might really speak to their needs and help to engage them in the services we were offering? And if they weren't there, but they were involved with their children, what could we be doing to invite them in and to make it a welcoming environment that they would want to participate in? And so, these questions, thinking about what it would mean and how we could better engage fathers in programming and support early father-child relationships is part of what motivated me to start a PhD program and to do the work that I do now. So I entered a PhD program wanting to think about opportunities for preventive intervention with families and how we could build strong early relationships, both between parents and children, but also strong co-parenting relationships. And, thinking about that with the goal in mind of strengthening the caregiving environment in a way that would lead to better outcomes for children. And so I learned kind of early on in my doctoral program that, not only was there this gap in terms of serving fathers, there's also kind of a gap in knowledge about fathers. So relative to mothers, fathers were also an understudied group. There were relatively few parent-child studies that either focused on or included fathers. And most of the studies that were out there that examined father involvement, most often they were using reports of mothers. So relatively little research that was looking at fathers' reports of how they related to their children and the ways in which they were involved. A lot of research, too, among the literature that focused on fathering, a lot of it was focused on the impacts of father absence, but not a lot looking at the impacts of father presence. And so that's really been changing. And over the last couple of decades, there's been just a pretty huge surge in research and interest and a growing body of evidence to document the important contributions of fathers to their children's development. And so it's exciting to see that body of knowledge grow, and it's also exciting to see growing attention in the field to better serving fathers and to thinking about father-friendliness of programs. So that momentum, I think, kind of carries into what we're doing today, where we have this great turnout of folks who are doing this work and interested in doing this work to engage fathers. And so I am, excited to get to spend this hour with you and have a conversation with you toward the end as well about this. And so I wanted to also just start by telling you that I recently attended a day-long program centered on fathers and their contribution to families that was sponsored by the Good Plus Foundation and Ascend at the Aspen Institute. And one of the presenters there, her name was Raquel Hatter, and she works at the Kresge Foundation. She opened her remarks by saying that the purpose of a focus on fathers is inclusion and not exclusion. And I thought that was a really straightforward and lovely way to make the point that exploring the important contributions of fathers is not to diminish the important contributions of mothers. So when I think about having this time together to focus on fathers, my focus here is thinking about inclusion and recognizing that providing the best possible support to children and families means understanding and seeking to meet the support needs of all family members and of families as a whole, recognizing that there is a whole lot of diversity among families and that needs for support will vary both across families and within families over time. So I want to start by just giving you a little outline of where we're going today. So I'm going to start by talking about who fathers are and how we're defining fathers as we proceed. Then talk a bit about our beliefs and values about the role of fathers, changing expectations of fathers. Then we'll think about how we conceptualize father involvement. What does it mean to say that a father is positively involved? What are we referring to? Then we'll talk about fathers' contributions to their children's development and the growing body of evidence for different ways that fathers have a powerful impact on children's development. And then last, I want to talk a little bit about communicating the importance of fathers. So once we've gone over some of the ways that fathers impact their children's development, I want to think with you about how we can communicate both to fathers themselves what their value is, but also to service providers and to other family members, why it's important to be focusing on inclusion of fathers. So first up, we're going to talk about who are fathers. So as we do this, I'd suggest as we go through this webinar that you be thinking and kind of holding in mind that there are many diverse family compositions, and that I want us to be thinking about fathers not only as biological fathers, but as any man who plays a fathering role in the life of a child. So someone who is caring for and raising a child. We know from the research that warm and loving father figures have positive impacts on children's well-being, whether they're biological fathers or whether they are social fathers or stepfathers or adoptive fathers. So we're thinking broadly here about the men who play fathering roles and recognizing that they play a critical role in their children's development. And then also holding in mind just the range of family structures that fathers are part of. So ranging from married to cohabiting, single parent, families that are combined families. So just thinking about these diverse family structures and that an individual father might have different connections and different relationships with different children in his life. And so next I want us to talk a little bit about what are our beliefs and values about the roles of fathers. So men's perceptions of their role as a father, what it means, what it looks like, shapes their involvement as fathers. And the perceptions of others around them also have an important impact. So as service providers, if we're communicating that we think fathers' roles are critical, that sends a powerful message. And on the other hand, if we communicate that the role of a father is kind of extra or optional, that sends a powerful message too. So I think it's pretty important for all of us to take the time to reflect on our own assumptions and beliefs and values about the role of fathers. And I want to offer and suggest a tool that you might use to support you in that process. So this is a tool called the Role of the Father Questionnaire. And if you look at the bottom of the slide, there's a link to the website where you can see the full, see this full tool and access it. So the full tool, the Role of the Father Questionnaire, includes 15 items that are designed to tap our ideas about the extent to which fathers are capable and should be involved with and sensitive to their children. So this is a questionnaire that was developed by Rob Palkovitz, and I've included a couple of sample items on this slide. So a couple of sample items are, it is essential for the child's well-being that fathers spend time interacting and playing with their children. Another is, it's difficult for men to express tender and affectionate feelings toward babies. And going through this whole questionnaire and thinking about kind of how true you believe each of these statements to be is an opportunity to think about your own kind of beliefs about the role of a father, and then to take a moment too to think about how that carries into your work with families, or your research on fathers and families, or your personal relationships with fathers, or your own fathering. And so as we get started, I also just want to acknowledge that notions of the role of a father are very diverse. So among those of us on the webinar, I'm sure there are a lot of different perspectives on what the role of a father could be or should be, the roles that some of you hold as fathers, or that others of us have experienced with the fathers that we grew up with, or other fathers that we know and care about. And so, so that's something pretty important to keep in mind in our work with fathers. And there are a number of factors that influence how a father views his role. So the father's own upbringing has an impact. So thinking about the fathering that he experienced, and sometimes that's something that a man might want to emulate, and other times it's something that he really might want to be really distance himself from and do things really differently with his own children. His cultural background influences perceptions of the role of a father. Also contextual factors, so thinking about the relationship that he has with the child's mother might have an impact on the role that he sees for himself in the life of his child. So a number of different factors that contribute. And just to offer up one example of the research that's been done in this area, Allen and Doherty did a study where they found that African American adolescent fathers emphasized the roles of provider of economic and emotional support, of holding the family together and providing leadership to the family. So that's an example of one study that looked at in a specific population of fathers, what the general beliefs were about what the role of a father is. And so I want to acknowledge that there are really different perspectives on that, and there is a body of literature that looks in different subpopulations of fathers at how people view the role of a father. So next we're going to move into thinking about what the expectations are of fathers and what they have been, and kind of how things are changing. So over time, the role of a father is really shifting, our general perception of what that role should be. So in my own research with fathers, I hear a lot about ways in which even men who feel like they had a really positive experience of being fathered want to do things differently when than what they grew up with their own father. So oftentimes what men will talk about is growing up with a father who really saw his role as that of a provider and wanting to be hands-on in a different way than their father was with them. So, in recent decades, we're seeing kind of rapidly expanding commitment and engagement of fathers to being present and being highly involved with their children and supporting their children's development in really hands-on ways. So thinking about the role as going beyond being a breadwinner, but also including the role of a caregiver and a nurturer. Thinking also about being a co-parent and sharing parenting responsibilities more equally with mothers. And so there's a number of studies that document changes over time, looking at survey data and time diary data, and looking at ways in which there's a trend of increasing father involvement with children. And there's also research to show, however, that fathers continue on average to spend significantly less time than mothers caring for children. So now I want to talk with you a little bit about conceptualizing father involvement. What does it mean to be a positively involved father? So Michael Lamb and colleagues came up with a model for engaged fatherhood, for involved fatherhood, that has been built on in a number of ways over the years, but continues to really inform the research, and I think has a lot of relevance for practice. So when they first thought about father involvement, they identified three domains. And so they talked about those domains as being engagement, accessibility, and responsibility. So engagement is direct interaction with children. So examples would be playing with a child, reading to a child, bathing a child or changing a diaper. So it could be kind of caregiving activities. It can be play. But those very hands-on activities are forms of engagement. The second domain that they talked about was accessibility, meaning fathers' availability to their children. So whether or not a father is at that moment engaged with his child, he's there and he is responsive when the child needs him. And he, another piece of this is kind of over time the child's awareness or sense of their father as being there for them when they need them. So particularly if you think about fathers who don't live in the same home with their children, accessibility is a really critical domain. Thinking about a child's perception that when he needs his father, he'll be there for them. If he needs to call him or text him, his dad's going to respond. So accessibility is another piece of father involvement. And then the third domain that they talked about is responsibility. So that's participation in decision-making and ensuring that children are cared for. So examples would be making child care arrangements or scheduling doctor's appointments, taking care of things that need to get taken care of for children. And so these three domains together they defined as father involvement. And keeping in mind these three domains is, I think, pretty important, because when we think about fathers who might have more limited opportunities to be directly engaged with their children, perhaps for custody reasons or other reasons, maybe for work reasons, there are limited hours that a father is able to spend with his children, recognizing and emphasizing that there are other ways of being an involved father, and that the time that you spend with children is very important, but that there are ways of being involved in addition to the actual kind of minutes and hours that you're spending together, is a way of just emphasizing that you're making a contribution in a number of ways. And when one way is not available to you, there are other ways to continue to be kind of present for and be a meaningful contributor to your child's development. And so this initial domain, the first domain of engagement, Joseph Pleck has kind of updated that in more recent years to be, he gave that a kind of a reframe and retermed the engagement domain positive engagement to emphasize that, that what we're thinking about with this engagement domain is the kinds of activities that are promoting positive child development. So building on Lamb's model, a number of scholars have continued to kind of build on that work and think about what father involvement looks like and what positive father involvement particularly looks like. And so a couple of key points in that body of work. So first is that, that people continue to emphasize that father involvement can be both direct and indirect. So financial providing is an example of indirect involvement, and direct would be caregiving and play. And then another theme in that work is that quality is really critical and is more meaningful than quantity of father involvement. So it's important to spend time with children, but more important than the exact number of minutes is the kind of relationship that a father is creating with his child and the way in which he engages with his child when he has that time with his child. And so there have been a number of studies to define quality and think about kind of what that looks like, and some of the key kind of attributes of high quality fathering are on this list here, and the source is down there. So this comes from a study by Allen and Daly, but they emphasize that when fathers are sensitive, when they build warm relationships, close relationships with their children that are, when the relationship is supportive and nurturing, that these kinds of qualities on this list are part of what contribute to kind of high quality father involvement. So other researchers have also just looked at the variety of ways that fathers are involved. I think this is a really useful list here for those who are practitioners to think about in terms of adding to kind of the range of ways that fathers see themselves as being involved. So sometimes there are more opportunities in one area than another, and so having helping a father to kind of be aware of the contribution he's making in each of these areas is a way of kind of highlighting what he's doing and also showing some areas where there's room to grow. So Palkovitz came up with this list. He enumerated 15 distinct ways in which fathers tend to be involved with their children, ranging from teaching their children to monitoring, meaning making sure a child stays safe, providing, like financial providing, showing affection. So I won't read through this whole list to you, but here is a list of 15 ways that fathers can be involved that is a useful tool to be able to reference as well. So some researchers have been focused also on exploring ways that fathers might be involved with their children in ways that differ from the ways that mothers tend to be involved. And so some of the early research on fathering was really kind of replicating studies that had been done with mothers and things that we knew about mothers and looking at how fathers were involved in similar ways or not with their children. And then there's kind of a more recent turn towards thinking about what might be distinct about fathers and fathering and what are some ways, some aspects of fathering that might really be kind of essential to fathering in ways that are distinct to mothering. And so some of that research has really emphasized play and focused on play as being central to fathering in ways that might be comparable to the way in which a lot of research focuses on nurturing behavior as being essential to mothering. And so there's research to suggest that on average, fathers tend to be more involved in play than in caregiving and to play really differently with their children than mothers do. And again, this is on average, so certainly there are some mothers who engage in kind of more rough and tumble play with their children. But as a general pattern, there's research to suggest that fathers tend to engage with their children in play that's more physical and challenging and that encourages independence and risk-taking. And so there's value that comes from this kind of play that's really distinct. So this is supportive of children as they learn to try new things and to face challenges and to believe in their own ability to kind of persevere through things that are challenging. And building on this body of research, there is a researcher named Daniel Paquette who developed a theory called activation theory. So many of you on this call, on this webinar, are probably familiar with the body of work on attachment theory. So attachment theory goes back, a number of years now, starting with Bowlby, was the scholar who first conceptualized this idea about the importance of parents providing kind of a secure base for their children to return to and comfort, and also a way of launching children, supporting them with kind of increasing exploration. And so in the work that has gone on around attachment theory, there is a way of assessing the attachment relationship between parent and child called the strange situation procedure that was developed by Mary Ainsworth and colleagues. And that is a protocol for looking at the ways in which a parent kind of relies on their parent for, the child relies on their parent for security and kind of returns to them and for safety and for comfort. And so Paquette developed kind of a counterpart to this, the idea being with activation theory that he is looking at what fathers contribute in terms of supporting children's exploration and encouraging kind of risk-taking within bounds. So thinking about children being bold and daring, but within safe limits. And so he created kind of a counterpart called the risky situation that assesses the activation relationship, which he thinks is really kind of at the heart of fathering. So according to Paquette and his colleagues, fathers have a crucial role to play in opening children to the outside world. And so he writes that fathers incite children to explore, take chances, overcome obstacles, be braver in the presence of strangers, and stand up for themselves. And so he created a protocol where children, this is for very young children, infants and toddlers, are in a situation where there are new toys and a new person enters the room. And if a child is what he would classify as underactivated, they might be kind of really anxious in that context. He would classify it as overactivated if they kind of are all in, kind of exploring the new things, but in ways that are a little bit reckless and don't listen as the parent tries to set limits. And then what he would consider as an optimal activation relationship between a father and child is when the child is being brave enough to try things, but is doing it in a way that's safe and listens to the limits set by their parents. And so he suggests that there's this need to also kind of recognize and value and assess the contributions that fathers make in the area of activation, which is an area that's really kind of a newer area of study. So from there, I want to move into talking with you about the benefits of father involvement. So there's research, an abundance of research, and just a growing and really substantial body of research that shows that children with engaged fathers benefit in very many ways. And so these benefits begin in pregnancy and they extend across the life course. And so we're going to talk through some of the areas where children show benefits, show improved outcomes from positive father involvement, and also just think a little bit about how it starts early and how it progresses and how there's an impact, as early as before a child is born and continuing on into even adolescence and adulthood. So during pregnancy, we know that partner support plays a protective role in preventing negative birth outcomes and promoting positive maternal and child outcomes. So women with supportive partners have fewer health problems in pregnancy. We also know that the quality of mothering provided to an infant is associated with the support that the mother receives from her partner, and that the quality of the relationship between partners predicts how both mother and father will nurture and respond to the needs of their child. So for those on this call who do work that begins during pregnancy or really focuses during that time period, there are opportunities to be thinking about setting up trajectories of positive father involvement even before the birth of a child. The support and the relationship, both the relationship between parents and then the bond that a father starts to feel with his child during pregnancy are things that can contribute to positive trajectories of involvement after the birth of a baby. And so there is a link here on this slide to a resource from childwelfare.gov, from a website supported by the federal government that offers a list of 16 things fathers can do to support their pregnant partners. So things like go with your partner to her prenatal visits, watch, listen, and read about prenatal development, birthing, and becoming a parent, help plan for the baby, help your partner stay healthy during pregnancy. And so the full list has 16 items, but these are some ideas for sharing with the fathers in your programs. And so next I want to talk briefly about fathers and attachment. And so I alluded to this a minute ago, but this bonding between father and infant can start even before the baby is born, as a father starts to kind of form ideas about what he imagines it will be like to have a baby, the kind of relationship that he hopes to have with his baby. So even before the birth of a baby, this bonding starts to happen. And the bonding that happens before the birth of a baby is kind of establishing a foundation and can influence the subsequent father-child relationship. So it's a really kind of important time to consider. And there's a lot of research that suggests it's a time that tends to be a time of high hopes when parents are, thinking about the kind of relationships that they hope to have and really kind of aspirational. And so it's often a time that kind of lends itself to intervention when you can, if you're working with an expectant father, be open to learning about kind of the relationship that he envisions and kind of what he's hoping for, and think with him about how to bring that about, what kind of support he might need to have the kind of relationship that he hopes to have with his child. So in my own research that involves a focus on men's experiences during pregnancy and across the transition to fatherhood, I hear a lot from men about kind of wanting to be there for their children, and that language of being there kind of gets used a lot. And then sometimes fathers struggle to talk about what that means and what that looks like, particularly if they are men who don't have their own role models of what the kind of father they want to be, if it's a man who wants to do things really differently than the fathering that he experienced. And so there's this real window of opportunity in pregnancy to support fathers in thinking about what it would mean to be positively involved and how they can make an important contribution to their children's development. We also know that there's research to show that infants develop distinct bonds with their fathers by the end of the first year. So infants who develop secure attachments to both parents, benefit uniquely. Each of those relationships is distinct, and having two secure attachment relationships is kind of added value for a baby. The way that those relationships get formed, the way that a secure attachment relationship is established, is when a baby experiences a parent, a caregiver who is sensitive and responsive to their cues and is consistent, that when the baby needs them, that parent is there and meeting their needs. So particularly in infancy, there's a bit of a cycle that happens where the more time fathers spend with their babies, the better they're able to recognize and learn how to respond to their cues. And the more that they are there and responding to those cues, that allows for the development of stronger attachment. And so we also know that fathers' relationships with mothers has an influence on maternal attachment. So fathers are forming their own attachment with babies, but also when fathers are positively involved and supportive of partners, that can influence maternal attachment in positive ways. And if fathers are abusive or in the absence of support, that also influences maternal attachment. So the benefits to children of positive father involvement are just very, very broad. So this slide just gives you kind of the umbrella statement. It's associated with positive social, emotional, and cognitive outcomes for children from infancy to adolescence. And there's a large body of work to support that. And we'll drill down kind of a little more specifically, but the big picture is that positive father involvement is associated with improved outcomes just across domains. So one area where we see that impact is with higher cognitive functioning and greater school success. So from infancy onward, children who have fathers who are involved in positive ways, who are involved in caring, when you compare that to children who have uninvolved fathers, the children with caring and involved fathers are significantly more likely to do well in school in a variety of ways, to have improved math and verbal skills, to be more ready at the time of starting school, also better able to handle some of the stresses associated with attending school. Children also benefit socially and emotionally. Their social emotional development benefits from positive father involvement. So children who experience a caring, involved father are more likely to be emotionally secure, to have higher self-esteem, to be more socially connected to their peers, to have fewer behavioral problems. So a number of benefits in this area as well. And then it's also important to note that these impacts are long-lasting. So the positive impacts of having an engaged father begin, as early as pregnancy and infancy, but persist all the way into adolescence and adulthood. So across these domains, we see that there are just benefits that continue to multiply over time. As late as adolescence and later in adolescence and in adulthood, there are also some studies that show some gender-specific effects. So showing that for daughters, having a positively involved father is associated with how daughters will handle their future romantic relationships, that fathers have a formative role to play there and are in more positive relationships with in their own kind of intimate relationships if they've had a positively involved father. And also studies to show that sons show fewer behavioral problems at school when they have a caring and involved father present in their life. And then another thing that I want to point out is the research on the intergenerational transmission of effects, meaning that there's the impact, the positive benefit that happens that is delivered from father to child, and then there is an additional layer that happens when that child grows up and becomes a parent and in the relationships that they have with their own children. So boys who experience caring relationships with their fathers during childhood are more likely to be positively involved with their own children as adults and are less likely to become violent men. So the flip side, so I've been discussing a number of the benefits associated with positive involvement in the form of kind of caring and loving relationships. And I do want to point out that there's a flip side here that when fathers are involved in ways that are negative, that is associated with negative developmental outcomes. So parenting that is harsh or parenting that is abusive is related to externalizing problems. And when fathers struggle with depression or other mental health problems, that's associated with challenges for their children as well. So highlighting the need for support to fathers when there are struggles. And so the things that I've been naming over the last few slides are ways that fathers directly influence their children and directly benefit and contribute to their children's healthy development. But fathers also have an indirect influence, and so that happens through their influence on the quality of the mother-child relationship. So when fathers are a source of practical and emotional support for mothers, that contributes to strengthened mother-child relationships. And fathers also have an indirect influence through all the aspects of their life that they bring to their children, through their social networks and extended family that they connect their child to, through their access to income and social capital and privilege, to the extent that these are things that fathers have and can offer to their children, children benefit. And so in addition to the ways in which children benefit from fathers' direct involvement and indirect involvement with their children, we also know that in family programming and services for families and in family interventions, when fathers are included, we see better outcomes of services for families. So examples include permanency planning in the context of the child welfare system, or parenting training focused on kind of education and support for new parents. When fathers are involved as well as mothers, that's associated with improved child outcomes. So the more effectively we can engage kind of whole families, the greater we might expect to see benefits from programs that we offer to families. And so as well as benefiting children and mothers, father involvement is associated with benefits to men themselves. So fathers report a heightened sense of parental competence, just greater parenting self-efficacy. They feel better about themselves and what they're able to do for their children when they are involved, and greater satisfaction with parenthood. So the more that they're involved in doing things with their children, just the better they feel about their parenting role. And so a couple of questions that came up in the questions that were submitted in advance related to particular subpopulations of fathers. And so I've got a couple of slides here that just speak to a couple of those that were raised by multiple people who registered for today's webinar. So a couple of people had questions about adolescent fathers and child development. And so first I just wanted to say that there's relatively limited research looking at the impacts of adolescent father involvement on children's development. So that's an area for growth and opportunity for those who are researchers on the call. But the limited research that there is shows that adolescent father involvement is beneficial to children and to their healthy development. But also that the quality of the relationship between parents is really critical, so that are really they're really kind of significant variable in terms of how fathers are able to influence and contribute to their child's development. For teen fathers, that is really, that pathway kind of really relies on the relationship between parents, and when that pathway is strong, then fathers have greater opportunity to influence their children's development in positive ways. There is also, among the literature on teen fathers, there's also a very strong and consistent theme that most adolescent fathers want to be involved with their children and are looking for those opportunities. But there are sometimes barriers to access if the relationship between the parents is fraught, or if the mother's parents think that the father is not going to be a positive influence on the child. So when teen fathers have the opportunities to be involved, there may be kind of need for support and work with families and extended families to keep the relationship such that they have continued opportunities to be present and involved. So another population of fathers that folks were asking about in the questions were wanting to know about the contribution of incarcerated fathers to children's development. And so the research in this area shows that paternal incarceration is associated with negative effects on children's outcomes in a number of areas. And so there's a growing literature that looks at the effects of incarceration on families, and some of the things that come out of this literature include showing that the effects of separation due to incarceration are more pronounced than other types of separation. And yet also the effects of incarceration are significant for children of non-resident fathers. So it's not only the separation that causes the impact that we see on children. It's also the stress and strain that could be associated with the experience of having a family member incarcerated. It could be the financial hardship associated with having a parent who's not able to earn an income. But so a number of things associated with incarceration lead to these challenges to children's development. But then there's also a body of research to show that a number of programs that are offering support with reentry are really having positive impacts in terms of supporting fathers and their children to reestablish relationships, or to the extent possible to sustain relationships during incarceration in ways that will mitigate the impact on children's development and help restore a positive trajectory. So So then once we've said all this and kind of gone through some of the ways in which fathers make a really important contribution to children's development, the next thing I think that it points us towards thinking about is how we can, as service providers, as people who have fathers in our lives, as researchers who study fathers and fathering, and whatever the roles might be that we each hold, how we can help to make sure that fathers are kind of aware of their value and aware of what they contribute to their children's healthy development and have the opportunities to be positively involved in ways that promote their children's development. And so there are a couple of layers to this communication. So first we need to communicate the importance of fathers to fathers themselves, and then also for other family members and to professionals who serve families, needing to communicate the importance of fathers so that others around fathers are promoting and creating kind of access and opportunities for fathers to be positively involved. And so some of the beliefs that act as barriers here include when there's a belief that father participation is not important, that it's extra or optional, or when fathers are seen as risk factors to their families. And so when those beliefs are held, they can create real barriers to fathers being involved. But we do know, from a growing and substantial body of research that most fathers really want to be involved and care about their kids and want to be the best parents they can be. So kind of changing the message and working when there are service providers who hold these beliefs, supporting them to kind of challenge those beliefs and think about the contribution that fathers make is really critical. And in our next webinar, we'll have more of a focus on how to develop service approaches that are accessible to fathers and how to really kind of engage fathers well so they can access the support they need to be involved. But I do just want to touch on how we can kind of change the messaging and communication so that these beliefs are not there to act as barriers, and in their place, fathers themselves and service providers and others hold beliefs that really promote positive father involvement. And so this slide and this list of 5 things that you should know about the importance of fathers comes from the Child and Family Research Partnership at the University of Texas, Austin. And the link is down there. I'll edit that slide before they get posted, since I see it's a little bit under the bubbles in the corner of the slide, and I want you to be able to read it. But these ideas get further developed at this link, but the kind of 5 key things that they are encouraging all of us to know about the importance of fathers are, first, that involved dads have a direct impact on their children's future. So some of what we've talked about today, that there are a number of areas of children's development are very directly impacted when fathers are positively involved, and that impact is lasting. The second point that they make is that families are strengthened by supporting fathers. So when we think about programs that are intended to support child development and help children to reach their fullest potential, we should be thinking about including fathers and including whole families, including everybody who has a key role to play in the life of a child in those programs, since families are strengthened when each individual family member has the support that they need, including fathers. The third point that they make is that policies and programs specifically for dads are on the rise, and they document some of those programs, and we'll hear from folks connected to 2 really wonderful local programs here in Wisconsin during the next webinar. But there is kind of a trend nationally to have more father-specific programming, and also to create more father-inclusive programming in child and family programs to when they're not specific for fathers, to really be opening them up more and making them intentionally welcoming of fathers. And there's also kind of a policy context in which this is unfolding, and policies are also expanding to support the role of fathers. So an example of that would be the Maternal, Infant, and Early Childhood Home Visiting Act, which provides funding and support for home visiting programs around the country. Within that act, there's specific language around the importance of engaging fathers in programming. So the fourth point that they make is that dads find immense value from their participation in programs. So there's kind of a growing body of evidence for that fathers find this meaningful, and that when they have opportunities to participate in programs that are about strengthening their parenting and supporting their relationships with their children, that fathers want to be involved and want to be great dads and find it really rewarding to participate in this kind of programming and find that it enhances their parenting. And then similarly, the last point that they make, or relatedly, is that the evidence based on the impact and effectiveness of specialized programs for dads is growing. So with increasing number of models kind of being tested for serving fathers, we're beginning to have more evidence of interventions that work and that are meaningful in strengthening father involvement. So one example of that would be the Dads Matter intervention, which is an add-on to home visiting that was developed by Jennifer Bellamy and Neil Guterman, researchers from University of Denver and NYU. And so they have created an add-on for home visiting programs that enhances the engagement of fathers in services. And so that's just one example, but there are a number of specialized programs now out there getting tested and we are starting to have a real evidence base for programs in a variety of areas that can strengthen father involvement and then ultimately lead to better outcomes for children. And so, on that note, as we wind down here, I want to remind you once more that we have this next webinar coming up on March 27th. And so some of the questions that were raised in the questions submitted by you all as part of your registration, some of them related to strategies for involving and engaging fathers in programming, and I wanted to let you know that I will hold on to those questions and use them to guide the content for the next webinar. But now I'm going to turn it over to Dave to host some questions, and we've been getting some questions coming in as we proceed through the webinar.
Well, thank you so much, Tova. That was just a wonderful presentation, and I just want to remind folks that they can type questions into that Q&A box at the bottom of their screen. And we've got about 15 minutes here, and so we'll see what we can get to. But Tova, as a first question, we have a question about, sort of talking about paternal bonding, especially around, right after children are born. Is there much of a screening? Are there screenings available to learn about father postpartum depression or perinatal depression, things like that we should be paying attention to when it comes to thinking about that early bonding taking place?
Yeah, so great question, and thank you for that. So I think there are opportunities, and so I want to highlight a couple of things. So one is that there is kind of a growing body of research around the presence of fathers in prenatal care settings. And so that is one setting for kind of encountering fathers and getting them connected to services. Within home visiting programs, I think programs need to be creating kind of more opportunities to engage with fathers, and so some programs are farther along than others in terms of encouraging and facilitating kind of father participation and thinking about how to schedule visits at times when they can either meet with both parents or have different opportunities at different times to meet with mothers and to meet with fathers in order to learn about what fathers might need. But there is a lot of research that shows that perinatal depression occurs in fathers as well as in mothers. It's not as prevalent, but it is actually maybe more prevalent than people might expect, and it has an impact on children's development. So screening and being attentive to fathers' potential depression is pretty important. There are new recommendations just out from the American Academy of Pediatrics suggesting that pediatricians should be assessing parents, so assessing mothers kind of regularly in the first year of life, and they suggest that at least once, I think it's at maybe the 6-month well-child visits, that pediatricians should be assessing fathers for potential postpartum depression. And that is really kind of grounded in the recognition that when either parent and the effects are compounded when it's both parents are depressed, but if one or both parents is depressed, that has an impact on children's development, and so pediatricians are kind of increasingly attentive to that. But in the context of home visiting, I think first is creating the opportunities to assess fathers by being sure to meet with fathers, and then getting some of the tools, and we could maybe kind of post links or include some links with the materials that go out from the webinar, but there are some resources for assessing depression in fathers and also for assessing early father-child attachments. There are questionnaires that exist for doing that.
Okay. Thanks, Tova. We have a question. You briefly kind of touched on just the potential for fathers being risk factors and that sort of thing. That's sort of like the flip side of this, and that was on your slide there. Do you want to talk more about that and perhaps strategies for how practitioners might assess those things and what their role there might be?
Mm-hmm. Sure. So thank you for asking that and giving me the opportunity to clarify that. So what I meant by fathers as risk factors is that we know that particularly in the context of child welfare, but in other systems as well, there are often concerns and very real concerns from service providers that fathers being present with their children or being kind of active within their families might pose risk to their children. So worries about fathers as potentially abusive either toward their children or to their partners or both. And so, that's an important risk to be wary of. And there are, some cases where it might not be appropriate for fathers to be involved if they are not safe to be around their family members. But then I think there is a problem where concerns about that sometimes lead to kind of a default assumption that it's better to limit fathers' contact or, kind of less openness to seeing the possibilities for positive father involvement among some fathers if service providers are really kind of centering their thoughts about fathers on experiences they've had with abusive fathers. So that's what I meant about fathers as potential risk factors. I think we need to be mindful of that, but we need to also be thinking about if fathers do pose risk to their children, what services and supports might we be able to connect them to try to reduce the risk that they represent to their families, and also to recognize that if they're going to be involved in the lives of their families, kind of anything that we can do to enhance fathers' well-being and enhance the parenting that they're able to provide is going to be important to their families.
Thank you. We had a question from Manuel about, so with fathers who have had children with more than one mom, and so there's a challenge there in sort of dividing their time between a couple of households. Are there strategies that people can talk about with fathers for how to kind of manage that and how to divide that time? Or do you have anything to say about that?
I'm sorry, can you just say that one more time, Dave? I didn't catch the whole question.
In terms of like multi-partner fertility or
yes,
fathers
okay.
that have children with more than one, yeah. Mm-hmm. So how do you help fathers kind of manage those situations?
Yeah. So great question. So I think one piece of that is being really mindful that a father's relationship with each of his children might be occurring in a really different context. So if you are in the role of, let's say, a home visitor or a provider of some kind of support to a father, some role where you are providing kind of parenting education and support, not to just talk about fathering as any kind of one thing and offer one set of skills as though it would be kind of universally relevant and could be applied in the same way in his relationships with each of his children, but really trying to kind of understand what the different kind of opportunities and barriers might be. So a father who lives with some of his children and does not live with some of his other children might need kind of tailored support for ways of engaging with the children who he sees regularly and ways of being accessible to the children who he doesn't see regularly and maximizing whatever opportunities he does have to be engaged directly. So a piece of it is just kind of understanding the context. I think, communicating with dads about the importance of their role, whether they're resident or non-resident, that their engagement and, their accessibility and their responsibility really kind of matters to their children. And also kind of across children with multiple partners, recognizing that, a father's relationship with the mothers of each of his children is going to have an influence on, the relationships that he has with his children, and that the children are affected by the co-parenting relationships too. So kind of thinking broadly about, this kind of web of relationships and recognizing that children, develop in an environment and a context of relationships, and thinking about how to help a father strengthen each of those relationships in ways that will maximize his opportunities to support each of his children.
Okay. We had a question from Darnell about some maybe differences in the ways that father involvement might matter for boys versus girls, or just different family sizes. I mean, how does it matter, if we've just got one child, or maybe just the time commitment of having, multiple children? Is there research out there that's useful and that we can kind of put towards this here?
So there is some research showing that father's involvement in different ways has some different impacts on boys and girls, and I offered a couple of examples of that, but there's kind of more out there, that we could look to. But but I think kind of the key takeaway is that father involvement is really important to both boys' development and girls' development, but sometimes looks a little different where those kind of effects show up. In terms of family size, I would suggest checking out the research of Brenda Voling at University of Michigan, who looks at the transitions as looks at fathers' roles and in the transitions that families experience when a sibling is added to the family. So after a first birth, what happens as children are added to the family. And one of the things that she shows that's really interesting is that kind of in the popular literature, I think there is kind of a sense that with after a first baby is born, when you have a second baby, that kind of the role of a father might be to really kind of take care of the second baby and kind of clear space for a mom to be focusing on the new baby. But in fact, mothers feel kind of most supported when fathers are really engaging with the baby as well, and it's really kind of important for the father to be forming a relationship with his new infant, and so as well as taking care of and providing a lot of support for the older siblings. So she's got some really interesting research just around just the complexity of adding to a family and the importance of kind of strong relationships among all the family members.
Okay. We have a question from Sarah about how providers should approach families that don't have a male figure, so whether it be single moms or female same-sex relationships. What are there approaches there that you can talk about?
Mm-hmm. Yeah, so that is an important question to raise. So thank you for raising it, Sarah. So there is good, solid, strong research to show that children thrive in families with a variety of family compositions, and children can do very well in in families where they are being raised by two mothers. So I would not emphasize concern. I wouldn't working with a family where there were two moms. I would not emphasize concerns about the absence of a father. But I think what families often do and can be supported to do is if there are important male figures in the family, to think about the kind of support that they that they might be able to provide in the ways in which that they could form kind of strong relationships with the children as well, since children, the more kind of strong relationships with people who care about them that children have, kind of the better for children. The other thing that I would say is that some of the things that I've highlighted in this talk that are contributions that fathers make, it doesn't mean that children can't receive those benefits from other adults. So certainly a mother or a grandparent or another caregiver or caring adult could really play a critical role in fostering activation, like we talked about, meaning supporting children to kind of take risks and be explorers in a way that is kind of safe, but is introducing some challenge and the kind of skills needed as they figure out the world.
Okay. Thank you, Tova. So we are just about out of time, but I want to give you an opportunity to kind of leave us with a parting thought here. What should we take away from all this, and kind of what are some directions that we might want to be thinking about going forward here?
Thank you. Yeah, well, thank you just briefly to both the Child Abuse and Neglect Prevention Board and to IRP for hosting this, and thank you to all of you who participated. The thing that I would really emphasize here is that fathers make really important contributions to their children's development, and that if you are at a program, if you work with a program where either that is kind of hasn't been so centered in your work, to be thinking about ways of bringing that more into the focus of what you do has real value. And so I would leave us kind of setting us up for the next webinar in the sense that there is this really profound contribution that fathers make to families, and so where that leaves us as folks who do research or provide services to families is thinking about how we can more effectively engage fathers in those services and support their engagement within their families, since in general there has been a pattern of fathers being kind of underserved and underattended to in research, and so I think there's opportunities for all of us to be part of correcting that.